Good afternoon. I'm Jeffery Jones with Universal Family Connection. I'm the Risk Reduction Manager, and I'm here with my coworker,
Mary Turpin from Universal Family Connections.
And thank you for tuning in. Today is December 6th, and this is our weekly call-in show. So if you are inclined to, if you hear something that you have further questions about or comment, feel free to contact us. Universal Family Connection is a 45-year-old social service agency located at 1350 West 103rd Street. Our founder is Dr. Lorraine Broyles, and so we come here once a month to talk about what we're passionate about, and that's HIV and getting to zero. There's an initiative here in Illinois called Getting to Zero, and what we do is testing. We do counseling for HIV as well as hepatitis. We do referrals. We also have a awesome support group on Fridays that's well attended. We serve a nutritious and delicious meal and talk about topics that those our clients come up with. So if any of this interests you, if you are a person who is living with HIV or AIDS, you are welcome to call into the show. You're welcome to come and visit us. You don't have to schedule an appointment or anything like that. Just come in on a Friday and we'll sign you up to be part of our group, and we would love to have you. We're located again at 1350 West 103rd Street. That's in the Beverly neighborhood, and there's plenty of transportation on buses that come right near our location. So check us out. If you want to contact us, our phone number, do we have a phone number here?
773-881-1711. And you can either ask for Mary Turpin, Jeffery Jones, Alade Adamoso, and we'll test you confidentially. Everything is done confidential.
Yes. So come on in and see us. And if you don't, if you just want to have some education done, if you're a principal at a school, a social worker, a counselor at a school, or a minister at a church, we are available to come in and talk about HIV, talk about AIDS, distribute condoms, and talk about how we can reduce HIV and AIDS in especially the African American community. So once again, call us. We're at 773-881-1711. You can also visit us at our website, which is ufcinc.org, www.ufcinc.org. So today we're going to talk about a few different topics, since we're at that time of year when open enrollment for Medicare ends on tomorrow, which is December the 7th. So we're going to talk about Medicare and how you can enroll and what's the benefits to folks who are HIV positive. Also, we're going to talk about what might be referred to as seasonal depression. Every year about this time, we have folks who are lonely. They're missing loved ones who may have passed, or wishing for days from yesteryear and things like that. And so they experience this, what's called a holiday depression. And it can be a really, really stressful time. And so what we're going to do is talk about that for a little while today and see if maybe we can offer you some suggestions on how you might enjoy the holiday season and minimize your depression. Okay? Mm-hmm. What do you have there, Mary?
For the benefit of those who don't know how HIV is transmitted.
Yes.
I can tell you that HIV is transmitted through contact with certain body fluids, such as semen, vaginal or anal fluid, and breast milk, and blood. Okay. Contact with these body fluid can occur during unprotected sex, or when sharing needles or other items with body fluids on them. Mothers can pass the HIV virus on to their babies during pregnancy, birth, and breastfeeding. Now, HIV cannot be transmitted through contact with sweat, like some people think of sweat, tears, and saliva.
Exactly. So you can enjoy the holidays and hug your loved ones,
Kiss them
and stuff like that. And you know what? It's important that this information continues to, we continue to share it, because the more I talk about HIV, or we talk about HIV throughout the city and at different places, you would be surprised, amazed even, how many folks who are unaware of how HIV is spread,
Exactly.
how it's not spread. They don't know about the treatment of HIV, and have so many rumors. And so what our job is, and what we enjoy doing, is really sharing with people that information that's necessary for you to protect yourself first and foremost from HIV. HIV is 100% preventable. Say that again, Jeffrey. HIV is 100% preventable. You do not have to contract HIV.
There's no cure, but it's preventable.
Exactly. There's no cure once you get it.
Exactly.
So, but we have so much treatment. They've really, the treatment for HIV has really advanced a great deal. And so the sooner that you are aware of your status, if you're HIV positive, the better your chances are of keeping the virus suppressed. What that means is there's not enough virus in your blood to even be detected on a simple blood test. And so it's important that you get tested at least twice a year. You want to do it twice a year. If you are sexually active, if you have more than one partner, if you know that you engage in needle sharing, intravenous drug use. Nobody is judging anybody. We are not judges. We're not here to criticize anyone's behavior. What we want to do is make sure that you are aware as soon as possible. And so you come into our office, we give you a HIV test, and the results come back within about 15 minutes. So you can get your results the same day. If you come back positive for HIV, we sit and talk to you about counseling, all of the options for treatment, and then we refer you right away to HIV provider, a physician that can get you on the medication that's necessary to keep your virus suppressed, to keep you healthy. And so you can learn all about that. It's important to us that folks understand and be vigilant about HIV. We just recently, what is the word I'm trying to find? Celebrated, I don't know if it's a celebration or acknowledged World AIDS Day. World AIDS Day, Mary.
40 years, not celebration, being aware.
Right, being
Yeah.
aware of HIV and this virus. And so December 1st, every year, December 1st, we commemorate those folks who have died in the struggle. We celebrate those folks who are doing excellent work
Exactly.
in HIV and AIDS.
Still living with HIV.
And so, right, we also want to encourage those who are living with HIV. And the word we're going to stress is living. You don't have to have a sad existence once you become HIV positive. You don't have to kill yourself. You don't have to look forward to dying or anything like that. You can live, you can thrive even after AIDS diagnosis. And so we have clients that have been actually living, thriving with HIV for 40 years. 40 years. Even older clients that are thriving with this illness. And really, for all practical intent and purposes, it's become like a chronic illness, just like maybe diabetes, hypertension, and those types of things. And so we think it's so important that you come in, get the treatment that's necessary, get your test. Another thing I want Mary to talk about before we go into this Medicare is PrEP. What is PrEP, Mary?
PrEP is a medication that given to one who think that they're ready to have sex and they don't know that their status is for a person who's HIV negative. You can't be positive and take PrEP, so it prevents you from getting HIV. That's what PrEP is.
Okay, and how do folks access PrEP?
By prescription from their doctor.
So you can get it. What's the cost for it? Is it expensive?
No, it's not expensive. You can get it through your Medicaid or whatever support that you have.
Also, and see, Mary is just, I put her on the spot. She knows, because she knows it better than I do, that the governor has provided funds for folks who want PrEP and
Yes,
can't afford it.
exactly.
So even if you have no money, right?
Right, you can get it, free of charge.
Right. So you can. So don't let that be a barrier. The governor here, J.B. Pritzker, has really made it easy to get PrEP. PrEP is that medication. You go to your doctor, you take an HIV test, they make sure that you're not positive, and then if you know that you are in a lifestyle where you enjoy unprotected sex, you have more than one partner. As I stated, no judgment, but we want you to make sure that while you are practicing safer sex, that you have access to PrEP, so that PrEP stops you from getting HIV from someone who may not be aware of their status.
Exactly.
Or someone who is still afraid and not really able to share their status. And it happens all the time. Like I said, this is not a judgment. We're just making sure that folks are aware that there are people around here, there are people here in Chicago or in Illinois who are unaware of their status. They don't know whether they're positive or not. And some of them are positive, but they still engage in unprotected sex. What we want to do is make sure that you know your status, and if you know that you engage in unprotected sex or need of sharing, we don't know how effective it is against intravenous blood.
And
but
it don't work like if you went out and had sex and you're going to go to the doctor and say, hey, I had unprotected sex last night. Well, can I have PrEP? It don't work like that.
Right. It's not like the day after pill. No. You have to have it in your system for 30 days before you engage in unprotected sex. Okay? So, yeah, that's
In the meantime, you protect yourself with condoms.
Right.
What do you think?
Actually, there's some other ways that you can protect yourself. You can be abstinent.
Exactly.
I know that's not a popular word, but abstinence is a 100% way of protecting yourself from HIV and AIDS. And as I'm talking about abstinence, there's another way that you can contract HIV. You can get HIV. I know a lot of folks don't know, but more and more people are doing tattoos these days. I have a tattoo myself. And you can actually get HIV off of the HIV in the ink well. So you always need to make sure that whoever you're getting tattoos from, that they use a fresh needle, that they use fresh paint, so that you don't get HIV through just getting a simple tattoo. So that's something to think about as well.
And you do not get HIV by drinking water behind a person, a glass.
Right.
So those are some of the myths that was long ago stated.
Exactly.
You can't get it by sneezing and coughing. So it's
anything like that, exactly. And so, like I said, that's important because we're coming to the holidays and talking about COVID and being in enclosed spaces. It's important that you know that just like I just had to sneeze on camera, you didn't see Mary say, "Oh my God," no, because it doesn't transmit like that. You don't transmit HIV like that. Now, COVID is another thing, so maybe we'll talk about that on the next episode. We have a few minutes left on the program. Really quickly, I want to talk about Medicare for people with HIV. And so here are some of the key facts very quickly. In 2020, more than a quarter, 28% of people with HIV in the U.S. Were estimated to be covered by Medicare. And if you don't, I'm not aware, Medicare is a federal health insurance program for people who are 65 or older, or younger people who have long-term disabilities like HIV. HIV sometimes becomes a disability, and folks are not able to engage in certain activities, work activities, and so they are covered by Medicare. Medicare covers a range of services that are important to people with and at risk for HIV, including prescription drugs, inpatient and outpatient care, and preventive services. And the reason we bring this up is because open enrollment for Medicare closes on tomorrow, December 7th. You want to make sure that if you have not selected a plan, you are HIV positive, and you want to update for a new year, you need to call your provider the first thing in the morning. You need to, you can go to the Medicare website, and they'll give you the information necessary for you to find a provider near you who can explain to you what benefits are available, and different carriers have different benefits available to you. And so you need to know the one that's best for you, your condition, and your schedule. And so I'm encouraging folks to make sure that if you are Medicare eligible, get that insurance. Make sure they have all kinds of benefits with Medicare. Some of the providers provide you with membership to health clubs. They have vision, they have dental, and all the stuff you'll need to thrive as a HIV outpatient. So it's important that tomorrow morning, or even this evening, I think you can still maybe go to Medicare.org and find out more information about how to access the care that you need, or to even update or change the plan that you currently have. You may have a provider that offers more in terms of what you can get from your Medicare. Medicare covers, as I stated, over 65 million people, and plays an important role in delivering these health care coverage to us, to people who are HIV positive. Okay? And so if you are HIV positive, you need to make sure that you are covered, or to find out if you are eligible for Medicare. Maybe you have something else.
Oh, well, I also have there's HIV medication to fight, there's medication to fight HIV also, such as Biktarvy.
Biktarvy.
Yes. Mm-hmm.
That's one of the HIV medications that's really effective, quite effective in helping to control HIV. And so that's what those medications are for. They're to control the virus, and what they do is suppress the virus to the point that even now they have what's called U equals U. And U equals U, it means, what is U equals U?
Undetectable.
Mm-hmm. Means undetectable. If you can't detect HIV in your bloodstream, it's untransmittable. So at one point you had to let somebody know that you were positive and had to use a condom. But when you are suppressed, virally suppressed, meaning that the HIV is at such a level because you're using your medication on time, a highly active retroviral treatment, you're using it every day as prescribed by your doctor, it suppresses the virus to such a degree that you can't even pass it on. If you have unprotected sex, and you can let your partner know that, you know, I am HIV positive, but I cannot transmit it because I am on the medication. And so that's one of the things that's really good now. So you can, like I say, we try to help folks to live a full life. And so getting that treatment is so important. One of the other things, and we're going to be addressing this, I wish we could have got to it, this time goes so fast, is the funding for HIV and AIDS. You need to know that we have a program here in Illinois. It's called ADAP. It's the AIDS Drug Assistance Program. Say it again, ADAP, AIDS Drug Assistance Program. And folks, I hear folks talk about how Magic Johnson gets some sort of magic pill, and that's why he's been able to live this long and shows no signs or symptoms of HIV. Well, that is a myth. That's a miseducation. Anyone who's HIV positive here in the state of Illinois is eligible to sign up and receive AIDS Drug Assistance Program. And so those medications, those same medications that Magic Johnson and those people who have the resources, they're available to folks who don't have the resources through your Medicare or through the ADAP program here in Illinois. So if you're concerned about, am I going to be able to get treatment for HIV? Can I afford the medication? I have no insurance. What you need to do first is to make sure that you receive an HIV test, and we do that every day. We're open 9 to 5. Our location is 1350 West 103rd Street. We're located in Beverly. There's a bus stop right there in the corner. We're located directly across the street from Julian High School. Come on down. Mary, myself, Lade, or even my director, Juliet Jones, will be glad to have you come in and do your HIV test, provide you with the results right away, and get you to a provider if necessary. So that's where you need to start at. Come in. If you haven't been tested recently, the doctors don't just give you random HIV tests. So I hear people say all the time that I went to the doctor and I had all of those tests done. No, the doctor does not give you an HIV test without you requesting, unless you are a woman who is receiving prenatal care. But if you're just the average citizen that's going in for regular checkup, routine checkups, your insurance does not cover HIV testing. So we do it for free. Come in, see our friendly faces, Mary, myself, and I promise you we'll be gentle. The test takes less than 5 minutes to actually administer and get all of your information, and then we provide you with the results in about 15 minutes.
It's just a prick in your finger.
Right, just a little simple finger prick, and sometimes we use a swab in your mouth, and we can get those done right away. Please come in and see us. We're located at 1350 West 103rd Street. My name is Jeffery Jones, Risk Reduction Manager at Universal Family Connection, and I'm here with my coworker, Mary Turpin.
And the phone number there is 773-881-1711. Call and ask for Jeffery Jones, Mary Turpin, or Lade Elamosa. And we'll test you strictly confidential.
Confidential. And we will hope I wish we could have got to holiday depression. But we will see you guys the first Wednesday in January. So we hope that you have an awesome holiday season, holiday season. Enjoy yourself, enjoy your family,
and be careful.
And be grateful and be careful. Thank you for tuning in, and we will see you in the new year.